Good evening, everyone, and thank you for joining this session. Forgive me, really, all for calling you together to speak to you, but I felt I had no choice but to share with the community some information. I know we all watch the media, and yet, despite that, I'm not sure it's yet hit the street. What's going on? There's a lot else going on at the moment. Brexit, this time of year, everyone is exhausted. But for whatever reason, I don't think the public yet fully knows and has absorbed what's happening. And I really just wanted to update everyone about the situation here locally in Northwest London, in our community. I've never hoped that what I'm going to share, I've never hoped so much that I should be wrong, but I fear I am not. And really, I'm just speaking as the spokesman for our doctors, sharing a little bit my own observations, but we've got used over the last few months to the COVID numbers being low, and we've had the luxury of taking things a little easily. But I want to let you know that the situation is rapidly worsening beyond perhaps what we yet realize now. I spoke yesterday in my weekly YouTube Devar Torah, but the situation is moving so fast that 24 hours on, what I said was nowhere near strong enough. My precious friends and community, I have no choice but to speak, and please forgive me. I apologize for calling all of us together, but I felt it's my duty to share my experiences and what I'm hearing from our doctors who are serving our Kehillah. I'm not saying anything new, just quoting what they're saying. The situation's escalated over the last week. It's escalated even as I was preparing to speak today, whether it's the new strain or other factors. Numbers are surging seriously. Casualty is struggling. Calls are being put out to doctors to come to help out, shifting treatment away from other areas. Today, I've received so many texts from doctors in our community. Rabbi Zobin, it's going to be bad, is what they're saying. It's already looking worse than March or April. I just got a text 10 minutes ago. Cases in my hospital, I'm going to anonymize which hospital, doubled in the last 24 hours. They're talking about taking CPAP machines off those less likely to survive to give to those more likely. Another doctor wrote, I just got home after 13 hours on the ward and will be back tomorrow. It's as bad as April. A doctor said to me just this afternoon, last week it was a trickle, then it was a stream, but today it's become a flood. This isn't scaremongering, this isn't a pleasant or easy message to deliver, but these are the facts. Some of our local hospitals are full, at times closed to ambulance with ICU at full capacity. Specialists are being moved back to COVID out of their own fields. Hospitals are swamped, annual leave being cancelled, ICU taking over additional wards, team leaves cancelled, numbers are rising rapidly, and there's every chance that services could be overwhelmed shortly. Beds are full in many of the units, new COVID wards are being created daily, and admissions have doubled just over the last week. Many who had it or thought they had it around Purim are having it again. It's a combination. Normal winter is affecting space, staff are self-isolating, sick, aren't willing to work in ITU, found the previous April experience too hard or exhausted. But we're heading into a situation where this can cause older and more vulnerable and the sickest patients being turned down for admission. The numbers being seen by the hospital at the moment are high, very, very high, full to the brim. And even in many cases, 20 to 30-year-olds are getting the symptoms and needing to be put on machines. So I wanted to speak to everyone and just alert us all. And I felt I had to use my platform and the opportunity for me to speak, to share the facts as they are on the ground. The situation, sadly and unfortunately, is serious again. And I know we're fed up with it. We've had enough. I know that we just don't want to hear this message again. And I know that we are hearing it slowly as it trickles through the media. But I had to speak clearly now. I felt there was no choice. The numbers are very high, overwhelmingly high again. And we need to hear that, and we need to take into account what's going on. We need to consider the situation and how we behave. Obviously, social distancing. Obviously, not socializing, not visiting people. We need to make sure our children, our students, our student age population, our friends, hear what is going on. We cannot afford to visit each other at the moment. We need to social distance. Shuls are still open, at least for now, and the advice is that if we're careful, risk is low. But we need within shul, obviously, to keep masks on over our noses, not to socialise. And actually, we need to consider the risks and consider whether it is appropriate for us as individuals to come to shul. Each of us knows our own risk factors, our own general health, but people who are over 60, 65, 70 need to think this through and think whether they should be coming to shul, and similarly taking into account other vulnerabilities. We need to be careful. Maybe a third of people are asymptomatic and don't even realise they have the symptoms, but this can have an impact on others. They can spread the infection, and as we said, particularly for people who are more vulnerable, older, that can be serious. We need to obey the rules. We need to watch out for the symptoms, and obviously we need to get tested. If we're unsure about the situation, if we're feeling ill, if we're feeling unwell, if we think it's getting dangerous, we need to call Hatzalah even on Shabbos. And certainly with the fast day tomorrow, anyone who's feeling symptoms should speak to a Rav or doctor as soon as possible. And if they can't do so and can't get through, they should not fast tomorrow if they're feeling symptomatic. This illness is unpleasant. There are huge numbers at the moment who are sick, whether it's because of the new strain, because of other factors, I don't know, and perhaps no one quite knows, but it's not really the point. It potentially can have absolutely lethal consequences, and even when it doesn't, the long-term effects can be nasty. Number of deaths at the moment is relatively low, somewhat because of the treatment improvements. But if hospitals become overwhelmed, deaths will rise again from COVID, and also rise again from the cessation of other vital and necessary medical activity, which has to be stopped in order to allow the hospitals to cope. If we're careless, we risk our own lives, we risk long-term impact on our health, and even if we're fine, we risk carelessly infecting others. We could, chas v'shalom, cause older and more vulnerable, more sick patients to fall ill, patients who potentially will not be treated in the end by the hospitals. So I want to use this platform to ask all of us in our kehillah and beyond, my dear friends, my dear community, please can we hear this message? Can we hear what's going on? The situation, sadly and tragically, is again serious, and we need to find that energy to get through it. Baruch Hashem, there's light at the end of the tunnel. There is a vaccine already being rolled out, and in the next few months, hopefully, things will become easier. I don't think I need to say to this community that when the vaccine is offered to us, we should take it. I don't think I'm speaking to a community where people don't understand what science is about, what medical research is about, what reliable scientific and medical information is. We certainly don't know everything in life. There are always questions, but we need to rely, obviously, on the weight of medical opinion and clear scientific research, which is that this vaccine is both effective and safe. We have, in these next few months, the opportunity to be makayim, to fulfill unusual mitzvahs that perhaps doctors have a lot of the time, but we don't. The nishmatim od nashosechem, looking after our health. Lo samod al dam reach, not standing by idly over the blood of our fellow human beings. We can use this as an opportunity for this unique time to do that which we're meant to be doing. We certainly should reinforce our tefillah. We should daven and pray to HaKadosh Baruch Hu at home without a minyan, if need be, if that's the correct choice for us to make. We can use this time to remind ourselves that we're not in control. We're not masters of our fate and of the universe. We can do chesed, to look out for each other and care for each other. Each time presents unique challenges, but also unique opportunities. We can be with the time. We can use this time for what it's meant for. This time will pass. In a few more months, we'll look back on it, and hopefully we'll be able to say, you know what? We lived up to it. It was tough, it was difficult, but we did that which was right for this season, for this time. In my Dvar Torah, which I only gave yesterday, and as I said, I didn't even then, 48 hours ago, realize the situation. But in my Dvar Torah then, I said that Asara B'Teves is a unique fast. It's a fast that we fast tomorrow on a Friday, going into Shabbos. We'll spend an hour of Shabbos in fasting, which normally we would never do. Even far more serious fasts like Tisha B'Av, we push off when they fall on a Shabbos. And Asara B'Teves is unique because, as explained by the Rishonim, it's described by the Novi as occurring Be'etzem Hayom Hazeh, on this very day. We have to keep it no matter when the day falls out. This is an interesting thing because the event it commemorates is seemingly less serious than some of the others, but the unique quality of Asara B'Teves is it was the beginning of the siege. It was the first warning shot. It was the first alarms going off. Nothing too bad had yet happened. Had we responded correctly at that point, we could have averted disaster. And when one gets those warning shots, be'etzem hayom hazeh, no matter what, one has to react straight away, even if it means there's a fast day on a Shabbos. We are within the shul taking further steps for safety. We're distancing and spreading the chairs more and trying to be a little more careful. But really the message is for each and every one of us as individuals to take this seriously within shul, outside shul, within our social lives, within the message that we give to our family members, to look after ourselves, to take the correct steps. It is in our hands to make this terribly sad and painful situation a little easier if we act correctly. And I want to conclude with the bracha and the words of the Novi Zechariah, Koyoma Hashem Tzavakos, Tzom HaRavi v'Tzom HaChamishi v'Tzom HaShavi v'Tzom HaAtziri. So says Hashem, the God of the hosts, the one who is in ultimate control of the universe. The fast days, in our context, the fast of the Asiri of the 10th month, Yer Lebeis Yehuda L'Sosin and L'Simcha and L'Moyadim Tovim, will be for the house of Yehuda as Sosin and Simcha, as happiness and joy, and as Moyadim Tovim, as great days. We can turn difficult situations into the good if we respond positively. And finally, the Novi Zechariah concludes the pasuk, V'ha'emes v'ha'shalom ehavu. You, we, all of us should love emes, that which is truth. We shouldn't blind ourselves to the reality of the situation, and shalom, peace, chesed, harmony together as a community. Dear Kehillah, friends, all of us, please listen to this message. V'ha'emes v'ha'shalom ehavu. We can love truth, we can love peace, we can get through this period, we can help each other, we can be sensible, we can be safe, we can hear what's going on, we can be alert to the situation, which isn't good, it's bad, it's very bad, but we can take the steps to soften it. Please do so, and in Mitzvah Hashem, all of us should enjoy and experience only good health together. Amen, and good Shabbos.